Welcome to Bear in Mind, the Brown Psychiatry Podcast, clear, current content about mental health. I'm the host, Dr. Tracey Guthrie, Psychiatry Residency Program Director and Co-Editor-in-Chief.
I'm the co-host, Dr. Camila Cosmo, Brown Assistant Professor and Co-Editor-in-Chief.
I'm Dr. Kit Queen. I'm a psychiatry resident at Brown University and script editor for today's episode.
And I'm Dr. Paula Baker. I'm the guest for this episode of the podcast about psychotherapy.
Welcome, Dr. Baker. We are glad to have you. First, a content warning.
In this episode, we will talk about sensitive topics, some of which you may find triggering. Our only purpose is to provide education and information. Our content is not to be considered medical advice. When you think of the word psychotherapy, what comes to mind? For some people, it's the classic image of lying on the couch talking about your deepest secrets, while others might picture any character from a movie or TV show that they've seen of someone being a therapist or a psychiatrist or a therapist. But the reality is quite different.
Scientists have shown that long-term therapy leads to real, meaningful changes in the brain, and psychotherapy is one of the gold standard treatments for many mental health conditions. But how does psychotherapy actually work?
To help us get to the bottom of some facts and myths about psychotherapy, we are joined today by Dr. Paul Baker. He is an assistant professor and clinician educator in the Department of Psychiatry and Human Behavior at Brown and assistant director of psychotherapy training for the psychiatry residency. Welcome, Dr. Baker.
Thank you for having me.
Thank you for joining us.
So, Dr. Baker, what is psychotherapy and what should someone expect in their first few appointments with a therapist?
I think at its core, psychotherapy is a conversation with a trained professional who knows you well, that is in service towards improving something about your life that isn't working for you. So the first few sessions with a therapist are really going to be about getting to know the therapist, letting the therapist get to know you, and really clarifying what it is about your life that isn't working for you and what you would like to see change.
Mm-hmm. And what are those first few sessions? What would they look like?
Yeah, so the very first session, the therapist is probably going to review certain elements of your medical history. They may ask you if you've had any past medical problems. They're going to want to know about any sort of past mental health treatment you've had. Have you ever been in therapy before? What has that experience been like?
Mm-hmm.
They'll ask you what other treatment you're currently getting. Are you seeing someone else who's prescribing medications for you? And how has that treatment worked? And they'll want to know about your personal history. They'll ask about probably your childhood. They'll ask about your current life, the kinds of things that keep you busy during the day. And overall, is your life working for you in the way that you want it to?
Mm-hmm.
Mm-hmm. So some people in our audience might be wondering, what is the benefit of seeing a therapist if I have other people in my life who I can talk about my problems, my concerns? So what are the benefits of psychotherapy?
I think that's a great question. I often hear from patients, why would I need to see a therapist? I have friends, I have a partner I can talk to. And I think that the real benefit of a therapist is that a therapist can say things to you that a friend could not. A therapist could say things to you that a spouse or a partner could not. And you can say things to a therapist that you might not be comfortable saying to a friend.
Mm-hmm.
If you think about all of the ways that we are with our friends, with our loved ones, we put effort into those relationships. And that may make it more difficult to talk about things that are troubling to us, things that we'd like to change in our lives. A therapist can be totally separate from the rest of our lives, our friendships, our relationships, and that can give the therapist a unique opportunity to help us make changes that would be beneficial to us.
There are lots of different types of therapy that are offered. Is there a certain type of therapy that you think is best or that someone should be looking for?
So this is a really great question. And here the data is mixed as far as how important the actual form of therapy is to getting better, to meeting your goals in therapy. There are many different kinds of therapy. There are what we would call behavioral therapies, where the therapist might help you with a phobia that you have. Let's say, for example, someone is struggling with a fear of driving on the highway.
Mm-hmm.
In a behavioral therapy, the therapist will work with you to gradually take on the task that is causing you the most distress and that you really want to achieve. Some therapies are what we would call skill-based therapies. So some people may see a therapist who teaches them skills to help them manage difficult feelings, to help them communicate better with their loved ones or other people in their lives, or learn skills to ground themselves when they become too emotionally activated or dealing with too many difficult feelings.
Mm-hmm.
Some therapies are a part of a school of therapy called psychodynamic therapy, where the goal is not necessarily to learn a particular skill or expose oneself to a particular anxiety, but rather to learn more about ourselves, to learn how we came to be the people we are today, and how we might be able to grow and develop further as human beings. And so there are many different kinds of therapies people can choose from. Much of the data suggests that, in fact, the most important thing is to have a therapist who understands you, to have a therapist who you really feel like gets what it's like to live your life. Because when people feel understood by their therapist, it's much easier to talk about difficult things, to make difficult changes. And so I often think that the most important part of therapy, or the thing that will make the most difference, is how well does a person feel understood by their therapist.
Mm-hmm. Just to follow up on that, because I like the breakdown of how you're describing some different types of therapy that's available. What if you are with someone who you feel truly understands you, doesn't challenge you to think about things differently, agrees with you, someone who it gets you, but just agrees with you?
The question I would ask in that situation is, am I getting where I want to be in my life?
Mm-hmm.
The reasons that I came to therapy in the first place, the changes that I wanted to see, are those changes happening?
Mm-hmm.
And if they're not, I would want to talk to the therapist about it, because any good therapist is going to want to know if their patient does not think they're making the progress that they want.
Right.
And that progress may involve more direct challenging from the therapist. It may be that we're talking about things that aren't really the best thing to be talking about. It may be that we need to shift the conversation in a different direction.
So always going back to the reasons you went to therapy in the first place.
Exactly.
What is the progress being made, and reevaluating that and discussing that and talking about that. So who might benefit from seeing a therapist? Now that we've defined this, who might benefit from seeing a therapist?
I think that nearly anyone could benefit from seeing a therapist. Anyone whose life is not working for them in a particular way, anyone who would like to grow and develop as a human being, I think could benefit from therapy. But to be more specific, certainly we know that people who struggle with symptoms of depression, symptoms of anxiety, panic, phobias, symptoms of eating disorders, symptoms of trauma-related experiences, all of those conditions can benefit from psychotherapy work. We also know that people who struggle to manage challenging feelings and people who struggle in interpersonal situations. So let's say someone who struggles to hold down a job because they just, for whatever reason, always find themselves in an argument with their boss. or they struggle to have a meaningful relationship because for whatever reason, it just doesn't seem to work out, or it always seems to end in a big fight. These are things that can be addressed in psychotherapy as well, that we don't always think so much about.
Mm-hmm. So another important topic about therapy is that you are really in a relationship with someone who you're trusting with a lot of sensitive information.
Yes.
And you are in a bit of a different dynamic and experience that you're having together where you are trusting this person to help guide you in a certain way to achieve the goals that you set out in therapy that you were just talking about. You need to reevaluate and see where you are. And so there are boundaries. Boundaries are where I end and you begin.
Yes.
The distance, the safety.
Yes.
And that is a very important topic in therapy.
Yes.
And there are certain things that have to be maintained and protected that are the responsibility of the therapist.
Yes.
So I wonder if you could talk a little bit about that so that people know when things are going well with their therapist and when they're not.
Yeah, so we had mentioned before the difference between a therapist and a friend. And I think that one sign that boundaries can be blurred is when your therapist starts to feel more like your friend. If your therapist is starting to tell you a lot about their own personal life or their own problems, or asking you for your advice in managing things happening in the therapist's life, that's a bad sign. That's a sign that boundaries are being crossed. And then there are other things that are even more concerning and would be more clearly out of bounds. So meeting with your therapist outside of a professional setting. Your therapist shouldn't be asking you to have dinner with them or have coffee with them. Certainly any kind of sexualized comments or sexualized behavior would be 100% out of bounds in a therapy relationship. I think all of us have a sort of internal sense of, ooh, something's not right here. And again, I think many people are very reluctant to do anything that might offend the therapist or that they think might make the therapist uncomfortable. But if you are feeling like, ooh, I don't know if this is okay, you should pay attention to that feeling. And you should speak with another provider if you're working with a different provider, or seek a second opinion from a different therapist or someone else who can maybe help you understand if the things that are happening are really okay.
Right. Because in an example, you could certainly see where if someone is having a marital situation and they're coming to see this, you don't feel heard by your spouse. But here is this person who's just always listening to you, always understands, validates, listens and reflects back to you what you said. And you may have feelings for that person. You may say, well, this is the person I really want to be in a relationship with.
Yes.
It's the therapist's job to manage that.
Correct.
To not exploit that.
Correct.
And exploiting that can lead to license termination. Crossing that boundary has severe consequences.
Yes.
And so I think it's important for people to know that these feelings do come up.
Yes.
But they must be managed and dealt with. And that's why you see a professional who is boundaried.
Exactly.
And considering what you just mentioned about the importance of the therapeutic relationship with the therapist,
yes,
how do you know if your therapist is a good fit for you?
I think this is a great question. I always go back to this issue of feeling understood. Can you tell that the therapist really gets what it's like to be living your life? Or is there something that the therapist just doesn't seem to understand? The therapist is saying something that lets you know that they just don't quite get what you're going through, or they don't quite understand why you came to therapy in the first place. So when that's the case, the best thing to do is to talk about it. I think often people are afraid of offending their therapists or afraid of making the therapist feel bad. But if a therapist says something that doesn't land well with me, that makes me think, wow, that really is not where I'm coming from at all, any good therapist wants to know that. If I say something to a patient that doesn't land with them, that makes them feel like I haven't understood them, I really want them to say, hey, I didn't like that you just said that. That didn't feel very good to me. And so the process of developing that relationship depends on communication from both sides, from the patient and the therapist.
So your mission about people assessing their progress through treatment, how can someone recognize their progress? What progress in psychotherapy means?
Yes. So an important part of setting goals for treatment is also determining beforehand how you and your therapist will assess whether you're meeting those goals. So it might be, for example, someone who's coming to therapy because when they become overwhelmed, they end up cutting themselves. It might be a matter of assessing how often does that still happen, or is it no longer happening? Someone who is coming to therapy because they frequently have panic attacks. It may be a question of how many times am I having a panic attack in the last week or 2 weeks? That can be a very clear and concrete way of knowing if we're making progress in therapy. It may be a matter of thinking about the strength of my relationship. So if I'm coming to therapy because I want to improve my marriage, for example, I may want to pay attention to how many times in the last week have I gotten into one of those really bad arguments with my partner? Or is that not happening as much as it used to happen? So no matter the way that you go about assessing progress, it's something you want to work out with your therapist beforehand as a way of keeping track of whether or not we're making progress in treatment.
And what type of clinicians do therapy? Are there differences between the therapies that are provided by the different clinicians that can act as a therapist?
So many different kinds of clinicians provide therapy, starting with psychologists who can be trained in various different models. A psychologist is someone who would have a PhD or a doctor of psychology degree, sometimes called a PsyD. Those people can provide psychotherapy. Certainly psychiatrists can provide therapy as well. A psychiatrist is someone who went to medical school and is a medical doctor, but can also provide psychotherapy. For different reasons, it's becoming less and less likely for psychiatrists themselves to provide therapy, but I still think it's an important part of the care being provided. Therapy can also be provided by licensed drug counselors, licensed marriage and family therapists, as well as social workers. I think that it's important for a patient to feel comfortable that they understand the therapist's credentials.
Mm-hmm.
And so again, it's a very reasonable question to ask a therapist, hey, what kind of training have you had? And what is your experience like?
Mm-hmm. So how long should someone stay in therapy? I'm sure this is a question that people want to know about all the time. Should you be in therapy indefinitely, or should it be just a few sessions and then stop? And how do you determine this?
This is a difficult question because there is not a lot of research to guide an exact answer. I think that the question of what brought us into therapy in the first place can be helpful in figuring out how long someone should be in therapy. Mm-hmm. You know, the process of creating goals for treatment happens at the beginning of therapy, but it should continue to happen over the course of therapy. So I think it is very reasonable every 6 months to check in and see, hey, those goals that we identified at the beginning, are we meeting those? Are we making progress towards those goals? Have we met those goals? If that's the case, should we continue this work? Are there other goals we'd like to work on, or should we take a break? So I think the answer to that question really should be made in collaboration between the patient and therapist based on, is progress being made? Are we getting closer to achieving those goals that we set out for ourselves?
Mm-hmm. And sometimes people are deciding between starting therapy, medication, or both. How do you choose between these treatment options?
Yes, I think that this is where a person's individual values are really helpful in guiding decision-making. Some people may really want to avoid medication treatment for any number of reasons. That person may be an especially good candidate for psychotherapy if they'd like to defer starting medication. But there's no reason that a person couldn't choose both. In many cases, the combination of medication and psychotherapy can be especially helpful and may help someone meet their goals faster than either one alone.
Indeed.
Changing gears a little bit, thinking about telehealth options for therapy. Telehealth has been around for a long time, but I think ever since the COVID-19 pandemic, it's become very prevalent. So I was curious, Dr. Baker, what your thoughts are about telehealth for therapy.
Yeah, so the landscape has definitely changed in the last few years, and all of us are learning and incorporating new technologies into the way that we are able to provide services to patients. So just to make sure we're talking about the same thing, when I think about telehealth, what I'm thinking about is the same kind of care simply being provided through the use of a video camera, where the patient and therapist are not physically located in the same space, but everything else about the interaction is the same. It's the same kind of service being provided. That's what the data on the effectiveness of telehealth services is really looking at, is that kind of setup. And so far, the data has been very reassuring that telehealth can be very effective, if not as effective as services that are provided in this services that are provided with the patient and therapist in the same location.
Right.
Again, the things that are important are, does it feel like this therapist understands me? Do I feel comfortable sharing things with this therapist? Does it feel like we're on the same page about what we want to accomplish together?
And the ongoing relationship that you're building over time is also really important. Seeing the same person,
Exactly.
I think, is really important because you're building quite a bit of knowledge on that. And certainly telehealth has really helped with access to care.
Yes.
With people working and finding time to not being able to get away from work and drive somewhere. It makes things much, much easier. So access to care has been significantly improved.
Or people in rural areas who just may not be able to find a provider
Correct.
in
Absolutely
their immediate
correct.
area.
So thank you, Dr. Baker, for describing and defining what you mean by telehealth, because there's a lot of different ways to define telehealth these days. And so I can appreciate us confining our conversation in this episode to this same exact thing that you would do in person, you just do over video, and the same boundaries and considerations exist. But there's lots of different things out there that we hope to address in a future episode of where digital health is going and access to care is going, and what different generations need. So stay tuned to that. We hope to have a future episode of that. But thank you very much for being on the podcast today, Dr. Baker. We really appreciate it.
Thank you so much for having me. It was a pleasure to be here.
Thank you. Now, a take-home message to bear in mind.
The key to successful psychotherapy lies not only in the type of therapy itself, but also in the therapeutic relationship you have with your therapist, as Dr. Baker has reiterated for us. In addition, for some mental health conditions, a combination of therapy and medications has been shown to be the most effective. If you're thinking about starting therapy, there are various online resources where you might find a good match, such as psychologytoday.com or ZenCare, ZenCare.co. Community mental health centers across the country also provide affordable treatment options for mental health support.
As always, if you or a loved one is having suicidal thoughts, please contact the Suicide and Crisis Lifeline by calling or texting 988 or accessing 988lifeline.org. The Lifeline is a 24-hour toll-free phone line. You can also go to the nearest emergency room and ask for help.
Thank you for listening to our podcast. For more information related content, please check out our Instagram, X, Facebook, and YouTube channels. Bear in mind the Brown Psychiatry Podcast. Thank you.